again, this is Roxanne, and I wanted to go over my dissection of the sheep heart. First thing I wanted to go over was the external anatomy. And the first thing I wanted to go over is the visceral pericardium, which is the epicardium that surrounds the heart. It's kind of like a silverish lining. This is the apex of the heart. This is the base of the heart. Okay. There are 4 chambers of the heart. This is the left atria and the right atria, the left ventricle and the right ventricle. So the blood in the right atrium here is deoxygenated, and the blood in the left atrium here is oxygenated. This is the left. Here's the left, and I should use this. The left and the right auricle. We could see there. Again, the left and the right auricles that are muscle pouches that help increase capacity of the atrium whenever there's blood flow. Okay, and again, this is the right and left ventricles. This here is the interventricular sulcus, which carries the anterior interventricular artery and part of the left coronary artery as well. Using this is the pulmonary trunk, and it carries the deoxygenated blood into 2 pulmonary arteries to the lungs. Okay, and then this is the aorta, which carries oxygenated blood to the body tissues. The ascending aorta would be down here. The aortic arch, which actually isn't part of this specimen, unfortunately, would have 3 major blood vessels: the brachiocephalic artery, the common carotid, and this left subclavian. But it would be part of the aortic arch. Okay, and the next thing I wanted to show was the superior and inferior vena cava. So by putting this probe through superior and inferior vena cava. Okay, and the coronary sinus, which is a collection of veins that carry deoxygenated blood to the right atrium, would follow here and kind of meet with the anterior interventricular sulcus. And now part of the dissection I wanted to also go over was the internal anatomy. So showing the right atrium, opening it up here. Okay. Shows the inner wall of the right atrium. Using the probe here. Let's see if I can open this up a little bit wider. Okay, so here you could see on the inner walls of the right atrium, you'll see the pectinate muscles and the myocardium of the right. Here's the right ventricle, the myocardium, and the left ventricle, myocardium here. If you can see, the myocardium of the left ventricle is actually 3 times thicker than that of the right ventricle because it must create a lot of pressure to pump blood into the aorta and throughout the systemic circulation. So again, this is the myocardium of the left ventricle, which is much thicker than that of the right ventricle, as you see here. as you see right here. Okay, and some other things that I wanted to show. On the inner surface of the ventricles, you could see trabeculae carne here on the inside, and also on the other ventricle as well. Trabeculae carne. And the interventricular septum, which can be seen here towards the back on both sides, is the wall or the lining that separates and divides the two ventricles of the heart. Okay, the bicuspid valve or the mitral valve, or the left atrioventricular valve, can be seen in the left ventricle. So here's the left ventricle here. If you look inside, the bicuspid valve here, and here's the chordae tendineae. Here's the bicuspid valve again. And the right ventricle, you could see the tricuspid valve right here. And again, more of the chordae tendineae. The cusps of the valve here. The cusps of the valve. Papillary muscle can be seen also here on the linings of the ventricle muscles. The pulmonary semilunar valve is in the right ventricle. Open it up again. So the pulmonary semilunar valve, the right ventricle, and the aortic semilunar valve would be in the left ventricle here. And that pretty much concludes my video, so I hope that you did enjoy. Thank you.